Hi, I'm Dr. Tanya. Welcome to Mommy Calls, your go-to source for everything pediatrics. Today's topic is breastfeeding. And breastfeeding is the best thing you can do to provide your baby with the best start in life. It's the perfect form of nutrition. It gives your baby all of the fats and calories and immunity and special proteins that your baby needs to grow and develop properly. Now, initially, after your baby's born, your body produces a substance called colostrum. And this is essentially the beginning of the breast milk. And it's very important for your baby. It has a lot of antibodies to protect your baby from infection. Over the first few days to the first week, you might notice the color of your breast milk change from the yellowish colostrum to the whitish breast milk. And moms often ask me, how do I know if my breast milk's in? Sometimes you can actually feel your breasts getting fuller and your breast milk coming in, but sometimes you just see that white milk dripping out of the corner of your baby's mouth or the first time they spit up, and then you realize, my breast milk's in, and that's actually a very exciting moment. So as your breast milk comes in, this is really the #1 source of food that's good for your baby. And initially you want to breastfeed your baby every 2 to 3 hours. Don't be afraid to ask for help. After all, breastfeeding, while it seems natural, may not be super easy initially for both you and baby. It can take a couple days or a couple weeks to get the hang of it. While you're in the hospital, you have nurses, doctors, and lactation consultants that can help make sure that your positioning is correct and that your baby's latching on well. So that way breastfeeding isn't painful and your baby is able to feed and you're able to enjoy the experience and bond with your baby while you're breastfeeding. After you go home from the hospital, sometimes your breasts change shape as your breast milk comes in. And even if you were breastfeeding very well in the hospital, it may become a little more challenging when you're home in your normal environment. So don't be afraid again to ask for help. Call your pediatrician, call a local lactation expert or your local La Leche League, and find someone that can help you, because often just 1 or 2 meetings with a lactation consultant can make a world of difference to make sure that you and your baby are breastfeeding successfully. Breast milk is fantastic for your baby. Not only is it the best source of nutrition for your baby, it's easy to digest, it's not expensive, and it's convenient. After all, you have it with you all the time. Breastfeeding is also good for moms. It's convenient, it's healthy for you, it can help you lose that pregnancy weight, and it can also lower your risk for cancer and other diseases. I'm Dr. Tanya with Mommy Calls.